The next topic is false recognition errors. Memory gaps and errors refer to the incorrect recall or complete loss of information in the memory system for a specific detail or event. So these errors are the errors, they are called memory errors, and they are the errors which refer to incorrect recall or sometimes complete loss of information there which is present in the memory for specific details. Memory errors may include remembering events that never occurred or remembering them indifferently from the way they actually happened. Two categories fall under false recognition error or memory errors. One is called false hit. Now, this kind of error is the identification of some item as old, although in reality it's a new piece of information. And the other category is called miss or misses, which means missing of an information or not being able to identify a previous information as old. Now we will look at the theories proposed by a number of researchers with regard to false recognition errors. The most famous is the Dees, Roediger and McDermott DRM task theory. In fact, this is the third category in addition to false hits, which means, or it can also be called false alarms. As I have explained, that false hit is the identification of an occurrence as old in reality, although it is a new information. And a miss is the second category, or misses you can call, is the failure to identify a previous occurrence as old. The DRM paradigm is a procedure in cognitive psychology used to study false memory in humans. Now, this procedure was introduced, or you can say pioneered, by James Dees. In 1959, but later on Roediger and McDermott extended the line of research in 1995, that the paradigm became very popular. Now the procedure that it follows typically involves the oral presentation of a list of related words, for example, bed, rest, awake, tired, wake, snooze. So, and then requires its subject to remember as many words from the list as possible. Now, typical results show that subjects recall a related word but non-presented word, sleep. So, in the list, which was consisted of bed, rest, awake, tired, dream, wake, snooze, blanket, so on, the word sleep was missing, but the subjects recall sleep word which was not presented, and this kind of phenomena is known as lure, which means tempting them to some piece of information which is either ambiguous or non-present with the same frequency as other presented words. So when subjects were asked about their experience after the test, about half of all participants report that they are sure that they remember hearing the non-presented word, indicating a false memory of an event that never occurred. So this again, if you look at it, is a task in which subjects are presented with the list of semantically related words. This is another example where you say nurse, hospital, etc. at encoding. Now, after a delay, subjects were asked to recall or recognize these words. In the recognition memory version of the task, subjects were asked whether they remember previously presented words. Typically, the critical word, which is the critical lure word doctor, Typically, this word is recognized with high probability and confidence. Now, this is the false memory, and its effect has been demonstrated across the line. The strength of using this task to study false memory is simplicity and short duration. Now, in terms of duration, if encoding and retrieval components of task occur in the same session, the entire task can take as little as 2 to 3 minutes. However, although DRM task is widely considered a false memory paradigm, some researchers consider DRM illusion to be based on activation of semantic memory network in the brain. And they also argue that such semantic gist-based false memory errors may actually be useful in some scenario. For example, remembering the forest for the trees, remembering the word list was about doctors, even though the actual word doctor was never presented for the study. So remembering the gist of the experience instead of or along with the individual detail is arguably an adaptive process, and this task has provided a great deal of knowledge about constructive adaptive nature of theory. So instead of considering this just as a false memory, sometimes this kind of errors help in assessing or providing facilitation to people in terms of remembering something. In terms of, for example, in the form of forest, it helps you to remember the names of trees, or in the list of nurse beds, hospitals, the doctor is something. By looking at these words which are presented in the list, one can take cues to come up with a critical word, which is doctor. Rediker and McDermott asserts that their results show that an individual's claim of vivid memory for an event cannot be taken as conclusive evidence that the event actually occurred. Critics, however, have argued that DRM paradigm does not reflect real-life events because of the nature of the stimuli and the setting in which the study is conducted.